So we have this special discussion on uh, counseling, counseling station. Let me give you a reminder about the exam structure. In the exam for MRCS Part B, all of you know that there are total of 17 stations. Out of these 17, 9 stations are related to the skills and uh, 8 are related to the knowledge part. So this counseling station is a part of the skills part. There will be two stations for counseling. One will be called to the consultant and other one will be direct patient to patient patient to patient counseling. So we are today with counseling of the patient. Call to the consultant will be covered on other lecture, not today. So remember, every one of you take your pencils and your copies, papers to make notes because it's very important to make the notes of the steps we are going through. Otherwise, it might be that you miss something, and that's very important. So we will go through um, all the steps which you have to do in the exam, how the case will be presented to you, how you have to prepare that in your preparation period, how you have to perform in the exam so that you may go through this important exam. Second thing is that this is the station where out of 20 you can easily get you can say 19, 20 marks because this is very easy to perform if you know the basics. You have just to cover the basics, you have to perform according to the protocols, and you can easily cover. So let's go through all this. So this is the for the counseling station. Okay, so in the counseling station, um, very important thing is that how the case will be presented to you. So for every counseling station, there will be two cubes, cube number one, and then there will be another cube, cube number two. So in cube one, you will be given 9 minutes, total of 9 minutes you will be given. This is the cube, this one is the table, and here is the file of the patient that is on this table. Okay, so out of this cube, there will be a question pasted here. And for this question, you will be having 1 minute. And for inside the cube, you will be having 9 minutes. Inside the cube are 9 minutes. Outside the cube, 1 minute to read the question and then to answer to just perform accordingly. So first thing I always say that this 1 minute is the key. If you don't understand what to do, what's your task, then it may be a big problem for you that uh, there was task something else and you have performed something else. So this will be a big problem for you if you have not got through this important 1 minute and you have wasted that. So what you have to do in this 1 minute, this is very important. In this 1 minute, you have to read every word of the question very carefully. When I say every word, so it literally mean every word. What do you mean by every word? Number one, what was the name of the patient? Maybe sometime they have given you the name of the patient. So you should know what was the name of the patient. Number one. Number two, who you are, what's your role. For example, they have said you that you are a surgeon, you are a consultant, you are an SHO, you are a registrar. So you will be given your own role, or you are an internee. So you should know who you are. Number two. And number three, which hospital you are. Maybe sometime they have given you the hospital name and everything. Okay. Is the patient is your own hospital, or it is a call to you from other hospital? It may be a call to you from other hospital. Number three, sorry, number four, what time it is. What time it is. It is morning, it is evening. Maybe that your exam is in the morning, but they have written in the scenario that it is, for example, they have written that it is 9 p.m. Okay. And you go inside and say good morning because your exam is in the morning. So that will be a big blunder. Okay. And that will be, it means, if you say, for example, in the scenario it is written that it's 9 p.m. and your patient is presenting to you, and you say, enter the cube and say that hello, good morning, uh, I am Dr. Muhammad Zulkarnain. And the patient says, oh doctor, it's morning, you have not read the question that it is evening, it's 9 p.m. and you're saying me good morning. So the impression on the examiner will be just not only a negative, but it will be, I say, destruction for you. So be very careful. What is the name of the patient, what's your name, what's your role, what's the hospital, if it is mentioned or not, what is the time. And then you have to read what is the complication the patient is presenting to you. This is not only for counseling station, this is for all the these skills part. Specifically, what is the complication you are going, what is the complaint of the patient. So the complaint of the patient is very important. For example, the patient is coming to you for back pain, or the patient is coming to you with the leg pain. So if this is a history station, for example, and the patient comes to you with leg pain is a one thing, and patient comes to you with back pain that is radiating to the leg, that is a different thing. So be very careful when you are going through this question. And then at the end, see what is the task with you. What is the task? Either they are saying to you to take the history or to uh, do the counseling. For example, in a history station, there is no very important thing that there's a patient inside the room and you have to take the history, and you have to actually take the consent from the patient for the surgery. So you should know that what is it actually written in the last line. What is that? So this 1 minute, if this 1 minute is destroyed, I would say your whole of the 9 minutes will be destroyed. So this 1 minute is extremely important. So for counseling station, um, every station. There is a one counseling station, and there is another uh, call station, call to consultant. So we are not discussing actually call to consultant right now. We are actually discussing only counseling station. For counseling station, they will give you two cube. One cube will be here, and there will be another cube. So this first cube is the preparatory. You can say that it is a preparatory one. So you have to prepare your case in this first cube. 1 minute outside, 9 minute inside. There is a table, there is a chair for you, nice chair, and then here is the file of the patient. And in these 9 minutes, they will you have to read that file of the patient and prepare your all the case very carefully. They have given you a pen as well as a paper, so you can make your notes on this paper and carry with you to the next cube, where there will be a patient and you have to do the counseling of the patient. In this room there will not be any patient. In this room there will be no patient. You have in 9 minutes only you have to prepare the case. So here is the file, here is the pen, here is the paper. You take your open your file and very carefully take all the necessary notes, and then carry these notes and pen along with you to the next room. Okay, so this is how you will be given in the exam. Okay, now next what to do. So there is the file, for example, and in this file, in just a second. Okay, so there is the file, and in this file what you have to read, this is very important. This is the file, for example, and in this file what you have to study and what you have to take the notes. So they same again. There will be given patient's name, confirm that, patient date of birth, patient date of birth, patient hospital name, what is the time, what is the time, and what is the complaint of the patient. This scenario might be there on the this file or might not be. It is different every time. So what you have to do, that take your notes very carefully. And how to take your notes, I always say that make your own arrangement, but we usually do is bar, is bar. So take your notes according to that. First thing is introduction. So you should know that who you are, who is the patient, where he is, what is the hospital, what is the date of the birth of the patient, and what is the complaint of the patient. Everything you should know. Second thing, the scenario. So in this file they will have given you all the details of the patient from the admission, along with the comorbidity, management, everything. So make three separate things always. Number one is history. Okay. Number two is examination, and then the labs, investigations. So because when you are going to present the case, you will present the case in a systematic way. It is not like you are going to um, ask the patient and sorry. So write down history of the patient, then examination, and then investigations, what investigations have been done, and then examination, and all these things should be written separately on your notes, so that when you go there with the patient, you know each and everything about the patient. Okay, these investigations are very important. Okay, and similarly the examination findings they have given you, and history in the examination, some they have sometime given you finding that, for example, this was the temperature before that, and now the temperature have decreased. So don't get confused that it was something before that and now it has decreased. Similarly, in the investigation portion may it be given that this was the HB on this date, and now the HB is this date. So read the date very, very carefully. Read the date very carefully. There will not be only one investigation, there will be multiple investigation, FBC done on these dates. Similarly the biochemicals done on these dates. So be very careful when you are going through investigation, or similarly the examination history will be almost like same. Comorbidities of the patients are very important. Comorbidities, so you should know all the comorbidities, what you are going to, when you are going to be analyzed on with the patient. So you should know all these things. So you, once you have gone through all the this file and you have made your necessary notes, now you are going to be on to the next, on to the next room. In the next room, again, there will be 9 minutes. We are going to make another room. So in the next room, there will be again 9 minutes. And in these 9 minutes, uh, I will make a big room. So in these 9 minutes, there will be, for example, this one is the table. Here will be two consultants, examiners. Here will be the patient, and here is the chair. And how now your 9 minutes are starting. Okay, this is the chair for you. Here is the patient sitting, maybe lying, maybe sitting, and here you are. Okay, and here are two examiners, and on the table there will be again file of that patient. There will be a file of that patient as well. Here you are given the, you have already your notes, and you carry those notes along with you, and you can put these notes on this table, and then you can uh, continue your talk with the patient. Now there are multiple steps to be uh, conscious about, because now is the actual task we are starting with. Okay, so number one, first thing is uh, settings. First thing is settings. How, what should be your settings? So this is very important. How to sit in this exam. For example, this here is the patient sitting, and here you are sitting, and you are facing on this side, or you are facing on this side. That is totally incorrect. Okay, that is totally incorrect. Both of these are incorrect. You must face the examiner. You must face the examiner. This is the right way. Otherwise, your marks will be deducted. Remember, I repeat it. You must face the, all of you most probably know that you must face the examiner. That is the only correct way. Number one. Number two, how you should be sitting on the chair. For example, this one is the chair, and you are just supporting your back on the chair. That will be extremely disgustful as well as unacceptable if you are supporting your back, leaning backward. So what you have to do, you have to sit at the edge of the chair, leaning forward, and your legs must not be crossed. Your legs must not be crossed. So leaning forward at the edge of the chair and legs not crossed and fully concentrated with the patient. And your paper will be here on the chair, if here on the table, sorry. If you need, you can say that I can check from my notes or check from file, and then I can tell you. Or otherwise you can keep your notes in your lap, and if required you can ask the patient that, okay, I'll see from my notes and will tell you. There is no harm in that, but you will not continuously looking at your notes. You will be continuously looking towards the patient. And last but not least, that your both hands should be on your legs. It should not be like your hands are just on the side. You are sitting. No, your hands should be in front of you on your both legs and should be moving. It is called as body language. So you'd be shown that you are actually concentrating over the patient. This is the setting, and this is extremely important because these examiners are all the time looking each and every move what you make, your language, your words, your everything. So this is the setting. Then the second thing here is your introduction. Second thing is introduction. So this introduction is extremely important, that how to introduce you, because it is different for the examination point of view. It is this different for the history, different for the counseling station. So if I ask someone, anyone of you, how would you introduce the patient uh, when you are going for the counseling station? Anyone? How will you introduce yourself? How will you take the introduction from the patient? Because it is bilateral, it's not unilateral. Yes, please. Yes, Dr. Freya. I think you are muted.
Yes, we can. Yes, we can say that. Hi, my name is Dr. Faria. I'm one of the surgical doctors treating you, your whatever the relation is. If I'm not wrong, you're Mr. Alex. That's how we can start.
Okay, good, good. So you will start, yeah, excellent. So you will not say that, hello, I am Dr. Freya. May I confirm your name and age, please? Okay, you should not start like that. You will start like that, hello, good evening. First of all, I always say that introduce, and before that, greetings. So hello, it is good morning or good evening, whatever the time is, with a good smile on your face. Okay, hello, good morning or good evening, and then a little bit pause. It's not like, hello, good morning, I am Dr. Zulkarnain, I'm one of the surgical candidate. If I'm not wrong, you're Mr. Alex. No, it's not like that. It is like that, hello, good evening, and then take a pause so that the patient responds you. So give a space. Hello, good evening. Hello, he will say good evening. I am Dr. Muhammad Zulkarnain, the surgical registrar or the doctor taking care of you. If I am not wrong, you are Mr. Alex, and may I confirm your date of birth. Then you can confirm your date of birth from the patient uh, that is written on you. on your file. Okay, so confirm the name of the patient, and then if the age of the patient written, you can ask the roughly the age of the patient. Okay, so that is how you have to introduce. So this is very important. Don't go and ratify, hello, good evening, I'm Dr. Zulkarnain, one of the surgical exam candidate, may I confirm your name and age, please? No, take a pause, just like you are in the your wards. So this is very important because this is a communication skill. Okay, so this is your introduction. Along with the introduction of the patient, so you got your introduction from the patient, and now after the introduction, what you want next is uh, to continue with the counseling station. So first thing you are going to do after this introduction is invitation. After this introduction, the first thing you are going to do is the invitation. So I call it as first invitation. So now you will invite the patient. This is invitation. So you will invite the patient first. Okay, Mr. Alex, nice to meet you. Uh, may I know what you know about your problem? So it is first invitation. So you will invite the patient. What does he or she know about the problem? For example, in some scenarios, there is angry patient or there is angry parents. So in how will be your introduction in that case? Anyone? If there is some angry attendant, angry wife of the patient or angry parent, how will be your introduction in that case? Anyone? For example, I give you a scenario that is a child 7 years old. She came with acute appendicitis. She is in the hospital. There is a mother. You have to counsel the mother, and now you have to go there and you have to counsel. So how will you be your introduction? Anyone? Am I audible?
Can I try, sir?
Yes, yes.
Um, it's like I'm Dr. Sadaf, one of the surgical doctor working here. If I'm not wrong, you are Alex's mother. And the uh, patients, if angry, say yes, then I will offer a chair, and if they are crying, or tissue paper, can you please sit and then we can talk?
Okay, good, good, excellent. So this is the exactly nice way to introduce. So when there is mother or the attendant, mother, wife, anyone, husband, anyone is there, then your introduction will be changed. So you will not say hello, good evening. So that is why that first 1 minute is important. In first 1 minute in the scenario, it will be written either you are talking with the patient or with the attendant. So remember very carefully, read that question. So you will ask, hello, good evening. I am Dr. Sadaf. I'm the part of the surgical team taking care of your child. If I'm not wrong, you are Alex's mother, right? Okay. So I want to talk with you about your child health. Is it okay for you? So this is the first invitation. Similarly, if the patient is himself, then you call hello, good evening, I am Dr. This, and I want to talk to you with your problem. Is it okay for you? So I'm sorry. Sorry. So you will this then you will ask the patient, can you please tell me what you know about yourself, your wife, your husband, your child, your father, whatever it is, or your mom, whatever it is. So this is the first invitation. So the patient will say, yes, I know this, I know this, if they angry, she will be angry, or like that. Okay, so what to do next? No, there is very important. The next thing, I'm going to tell you, that is extremely important, and that is, uh, don't be dead. Okay, don't be dead in front of the patient. So don't be statue, I will say, not dead. Don't be statue. So in front of the patient, when this is extremely important point, when the patient is seeing you some his or her story, or a relative story, so you're not side just like listening. No, you will be saying, all right, okay, understand. So you will be nodding your head. Number one, you will be nodding your head. Along with that, you will be just like saying some words. Okay, all right, I understand. Oh, I'm sorry. Just like these words. It's not like you are sitting there and just listening. That will be a negative approach towards your communication skills. So don't be a statue when you are listening to to the patient's story. So now the patient has completed the story, and now you have to speak someone next thing, and that is, I call it, between the lines. So your next thing is that you will not say directly, okay, tell me what happened to um, your okay, tell me what happened to your child. No, are you not say that, okay, we are going to operate your child. No, are you not going to say, okay, we have done ultrasound investigation and all these investigations, and your child had acute appendicitis, we have diagnosed. No, it's not like that. When the patient has completed his own conversation, at the end, you have to fill the gap. This gap must be filled. I use the word must be filled with some words. What are those words? For example, you will say a patient is saying a sad story. You say, oh, I'm really sorry to hear that. And I always say that your sorry should come from the foot and not from the head. Your sorry should come from the foot, not from the head. For example, what when I say this word, what does it mean? You say, oh, I'm sorry to hear that. This is one way. Otherwise, oh, I'm really sorry to hear that. So your voice is going down, your head is going down, and your words are, oh, I'm really sorry to hear that. So this is the way to say sorry. If you say, oh, I'm sorry, so this is another way. Both are sorries, but first one, I'm really sorry to hear that, coming from the foot, very humble, that is acceptable. Other one is not. Okay, so your sympathy should be very, very fine, and it should be sympathy. Okay, okay. So next thing is that between the lines. So once the patient has completed his talk, next say that, for example, the patient said that all the story. No, you're saying, oh, I really appreciate that you know all these things. If the patient has asked you some question, for example, patient asked you, okay, doctor, can I see my child? Or you says, okay, my patient is having acute appendicitis, is it really a bad infection? So you are going to not directly say, no, it is not a bad infection, it is very common in the childhood, and usually it is in 7 to 10% of the people, and we do the surgery and not these things. No, not directly start it like that. You will say, I appreciate your concern. I understand your concern. Your concerns are genuine. I totally agree with you For example, if the patient is saying some other thing like these are the complications she can get, I totally agree with you. So you are not directly starting your answer. First, you will uh, just try a filler. So these are the filling sentences I am going to dictate. You can write down. I can also try to write down here for you. So let's uh, write down these sentences for you. This is very important sentences. So these are very important sentences. For example, I completely understand your concerns, Mr. Alex. Next, I your concerns are genuine. Your concerns are genuine. I understand your worries. Don't worry, we are here to help you in our best way. So these are 4 5. You can use your own ones as well if you know. So you can use these fillers in these sentences. So this is very important. If you start directly answering the question, that is a negative approach. So this is very important. So next is after this all introduction, invitation. Okay, there is also a second invitation along with that. Um, Here, there is a second invitation, and that is very important. And that second invitation is, uh, do you want to involve someone else? Involve someone else in this discussion? In this discussion or not? This is extremely important. This is a second invitation. Okay. So first invitation was, what do you know about yourself or your patient? Second invitation is, do you want to involve someone else in this discussion or not? Remember, if you have not asked this one, your marks will be deducted. It may be that the patient wants his or her partner or husband, someone else to be involved in this R discussion, and then you are going to lose your marks. Okay, and at the end of the your counseling station, you are counseling the when you ask the patient, do you have any other question, and you ask it, and the patient says, yes doctor, I want to tell you all these things to my husband, for example. So this will be extremely annoying at that moment. So remember, don't miss that second invitation. So you are going to ask, then you are going to answer the questions, and your questions should be, just let me try to fit it. Okay, so seventh thing is that your knowledge, your knowledge. That is very important, because you should give exact knowledge what you have at that moment. If you don't know anything, don't bluff it. Remember, if you don't know anything about the, for example, the patient asked, how much is the risk of infection after this appendix operation? I'm just taking the example as this appendectomy case. So if the patient asks you how much is the risk and you don't know exact at that moment, you what you should be answer, I understand your concerns. Obviously, there are risk of infections. I don't know exactly what the number is. I can confirm and then I will let you know. There is no harm in answering this thing. Why? You have to be safe. You have to be safe for the patient. If you know, you say, okay, doctor, I know this is there are no risk of infection because there will be a totally aseptic condition and there is no risk of infection at all. No, there are risk of infection. There are risk of, so your answer is going to be wrong, and that is not acceptable. But you can say, okay, doctor, there are chances of infection, but we will try our all facilities to make it as minimum as we can, using aseptic measures. And but there are chances of infection. I don't know exactly the number. I can consult and will let you know. That's all. Okay. So now you completed your task. For example, I'm going to raise it. Okay, so this was the seventh thing, and let's start the next one. Next is at the end of your answer. Your answer. At the end of your, what we do normally is we uh, do answer, and then we wait for the question from the patient. This is the normally we do. That is the wrong way. For example, I say, okay, uh, we have done investigations, and your baby, we have done investigation, your baby is having infection of the appendix, and that is the appendicitis, and now we are going to operate. So we stop it, and then we are waiting for the answer from the patient, from the patient or the examiner, for the patient or the attendant. So we are, for example, waiting for that. That is not acceptable. So remember, write down this. At the end of every answer, you have to ask the patient, ask the patient what you will ask. This, sorry, is it okay? All right, you understand my point? Are you getting me? So any of these sentences, are you getting me? So any of these sentences at the end of your every answer, you have to ask the patient, Dr. Rahil, we will take your question obviously at the end. At the end, we will take the question. Don't worry. So uh, you have to ask the question, and then the patient will ask you the next question. Okay, for every answer. Second thing is that when you are going to consult the patient, your sentences should not be long. um, this is very important. Your answer must not be more than three sentences. More than three sentences. If it is long paragraph like written in your books, so that is going to confuse the patient, the examiner, and also going to confuse you after 2 months. Okay, so remember, don't confuse anyone. So so your answer must be consisted of 2 to 3 sentences. After every 2 to 3 sentences, ask the patient, is it okay? Are you understanding my point? So that when you will ask, he or she has understood what you have told the patient. This is very important. So No, you are completing one conversation, answering one question, and then asking the patient that have you understood my point? Is it okay for you? And next, no, you are going to uh, answer every question, and you have completed at the end. So what you have to do at the end? Let's see what you have to do at the end. Now, when you have completed this thing, you have to ask the patient, is there any, sorry guys, this is a problem. Okay. So ask the patient, should I summarize it for you? Should I summarize it for you? So ask the patient. When you have answered all the questions, ask the patient, should I summarize it for you? And the patient will say, yes, 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 summarize it for me, or anything like that. And then you will summarize all the things very carefully. How you have to summarize? This was the question asked many a time, that how you will have to summarize. So your summary will not be like long summary. It will be a short summary. For example, this taking this example of appendicitis, the patient came with appendicitis. So you will say, okay, um, let me summarize it for you, Mrs. Alex. Your child came with pain in the right side of your tummy. We did some investigation. It showed that there is inflammation of the appendix. We call it as appendicitis. We managed the patient. We gave administered some antibiotics, and now uh, he needs your child needs surgery, and Mr. Man is our consultant who is going to do the surgery. After the surgery, you can see your child, and she will stay for 1 2 days with us. That's all. And after that, there is third invitation. There is third invitation, and that third invitation is uh, like, do you have any question? Do you have any question? Third invitation is, do you have any question? So you will ask the patient or the attendant at the end, do you have any question? And the patient will say, if there is any question, he will say. Otherwise, we will say that no, I don't have any question. Thank you so much, or whatever. So, for example, the patient says no question. What will you do next? What will you do is say the patient, thank you so much for your time. For your time. If you have any problem, I will keep my number here, and we are all here to support you. Whenever you need, you can ask the nurses and they can contact me, and I will be here for you. And um, that's all what you have to do. Then there are some troubleshootings, and these troubleshootings are very important. Why? Because this without these troubleshootings, there will, in every question, in every scenario, they will give you some troubleshooting. So this troubleshooting is what kind of troubleshooting you can get in your exam. For example, there is a patient, angry wife or angry mother, and the mother is, for example, this mother, she is crying. and she is not sitting on the chair, she is wandering in the room. So now what to do? The patient is wandering, the patient is crying, and what to do? So what you will do, when you will enter the room, there will be some tissue. Take that tissue, go near the patient, and ask, hello, very politely, hello, good evening. You say, hello, good evening. What, doctor? Who you are? I'm not listening to you. I don't know where is my child. Listen her very politely with the patience. Listen her completely. Let her speak. When she has spoken, then say, I'm sorry, doctor. I am the doctor here taking care of you, your child, and I came here for your patient, for your child. So, can you please have a seat and so that we can discuss about the condition? No, doctor, I'm not going to have any seat. I don't know what you are doing with my child. I came here. My child is going to the operation theater. No one asked me. They going to theater, and even I was not informed. I was informed by the hospital staff and not by the doctor. Okay, I understand. Actually, we are taking care of the patient. We are busy with your patient, and that is why I am here to discuss with you about the condition of your patient. uh, is it possible if you have please a seat with us here, and then we can discuss your problem with your patient, what is going on with your baby. And after one or two sentences, the patient will obviously, because these are usually there will be simulator, so they will sit on the chair, and then you start your discussion. What you do if the patient is crying? So if the patient is crying, just offer the tissue and show your empathy. Okay, just offer the tissue and show your empathy and ask the patient, I understand it is obviously troubling for you. We are totally here. We are here for you and your patient, obviously, and we're trying our best um, to for the complete recovery. But you know the problem already, so start with that. Don't touch the patient. Give, offer the tissue, offer a cup of water, and then uh, hopefully that will uh, resolve the issue. Usually the patient, obviously they will not be so harsh, but these are the issues like crying, wandering here and there, and then asking you different questions. So this is all about the counseling station, and at the end you say thanks to the patient, not to the examiner. You can say when you're going to coming out of the room, thanks to the uh, examiner, but it is not part of your exam. Okay, and it is not assessed, so you can say simply thank you so much for understanding, and that's all. Okay, and if you need to have a second look on your file, you can ask the patient, okay, I will look, and at the end, then for example, the patient asked, doctor, um, my blood was taken today in the morning, and what are my labs, what are the results, and you know don't know exactly, for example, at that moment, that what was the exact, you don't know, for example, exactly at that moment what was the result. So you can go back, check on the labs, and say to the patient that this is the result. So this is how you can complete it. So now is the question answer session. If anyone has having any question, they can ask. Yes, please, Dr. Rahil, unmute yourself. Dr. Rahil, you are not audible, please. Okay, anyone else having any question, please? Yes, Dr. Aksar.
Hi, Dr. Vikanan. How are you? Hope you find doing well. Can you hear me?
Dr. Aksar, your voice is audible, but it is not clear.
Uh,
If you are having
okay,
hands free, please take your hands free out.
okay. Is it audible now?
Yes, yes,
I have one question. In my last attempt, I had a scenario of angry patient. The
yes.
patient kept arguing again and again. I did not reach at the end, and the patient was not satisfied till the end, and the time came
Mhm.
ran out.
What was the scenario?
The case was postponed third time for knee surgery,
For knee
and the
surgery.
patient was very yeah.
For knee surgery. So, what was the
Yes.
question of the patient?
He was angry about that the patient case has been postponed third time.
No, no, I mean, at which point the patient was not satisfied.
Patient was not counseling on the point that he was not agree that the case should be postponed third time. Anyhow, he was willing for surgery on the given date. But the command was to inform the patient that the case has been postponed due to the urgent surgery. It is from the scenario May 23, Islamabad.
Okay,
So any
okay.
troubleshooting or
The case
further?
is yes, yes. I understand. Thank you so much for your question. Thank you so much.
Thank
So,
you.
sometime this is the case that the patient came to you and saying that okay, I am not I'm, no, I need this surgery right now. So now here is your skill. You have to be very humble, and you ask the patient, okay, because this is really a straightway scenario that the patient is having two postponed before that for arthroscopy. Now it is a third time for the arthroscopy, and the patient has been patient has been postponed, and now you are, because your consultant has gone to some emergency surgery, so not doing that. Okay, so what you have to do, uh, first ask same thing, start with that. Ask the patient that what's the problem, what do you know about your problem, same thing. And then be very humble. I'm really very sorry to hear that, doctor. I'm really sorry to tell you that your case is being postponed today. uh, Now what you have to do, you have to do it balance. Why or not you do it? Because there are three options. You do the surgery, number one. Number two, any other consultant do the surgery. Number three is postponed to the next appointment. So you have to consult the patient for these three things. Number one, why you cannot. I'm sorry, I would have done this surgery, but there are two things. Number one is that I'm not authorized to do this surgery. Number two is that Mr. Man, who is the consultant, he is he knows everything about you and your problem, and he has seen you from the very beginning. So it is the best way that you get your surgery. However, during this period, we will not leave you alone. We will give you some medication for the pain. We will tell you some painkillers. If you need some rest, we can give you a medical rest. If you want us to talk with the occupational therapist, we will talk to them. If you have some problem with your uh, this about the household, we can talk with the social therapist. So we're not going to keep you alone. We will try, we will be here for you for your every problem, but we are really sorry, all we are doing is for your benefit. All So you have to tell the patient that you are uh, postpone postponing the surgery because of the patient's well-being. Every sentence, in every sentence, this should be like you are doing it for the patient's welfare in every sentence. So this is the troubleshooting for this case.
Okay, thank you.
Dr. Aksa, are you satisfied? No? Okay. Yes, Dr. Shafiq.
In my exam, the angry wife, because of the CT scan postponed, she kept asking, "Doctor, tell me, is this cancer or not?" When I told her that the fluid analysis shows that it must be cancer, but we are not sure, we need some other investigation to confirm it. Then, when she asked, "Did my husband need a surgery?" Then, when I told that it's the presence of the tummy fluids, give an impression that it's a case of an advanced cancer. In this case, it will be unkind to put the patient in suffer and pain with only little benefit. Then she asked, on one side you are not confirmed that it's the cancers, and on the other hand you are saying that it is an advanced cancer, so you are not
So,
operating.
so actually, you contradicted it. What you have to do, for example, if ask uh, that okay, because you need CT scan to confirm that from where the cancer cells are coming. So, what you will do? Okay, I totally understand your concerns, and we are first thing is to convince the patient that you are with their side. So thank you so much for your concern. I understand your concern. Thank you so much for your question. Thing is, see, Mrs. Alex, we have done this test, and this test shows that there are some cells which are cancerous cells, and they are coming from some body. We don't know the origin of these cells coming out, so that is why we are going to do a CT scan, and it is extremely important. And unfortunately, the CT scan is not working. Are you with me? So, are you with me? Okay. Thank you. So, what we are going to do, we will do a CT scan, and we'll see that where is this, are these cancerous cells coming from? Okay, then, regarding your question for surgery, thing is, see, Mrs. Alex, we don't know from where are these coming. After the city report will be here, we will do a meeting that will involve the surgeon, the pathologist, the radiologist, the oncologist, the nursing care, and everyone will be involved. And then we will see which one is beneficial for your husband. So, are you understanding my point? So we cannot say actually at this moment what is going to be, because we need a CT scan.
Okay,
Okay,
thank you, sir.
Dr. Shafik?
Okay.
So remember, in any case, you are not going to do the decision that it is the surgery or not the surgery. Put the patient in MDT for all these things. For carcinoma, I always say MDT. Without you can never, even the consultant cannot take the decision. Even if there is some carcinoma is diagnosed and it is not an emergency, a consultant cannot take the decision. He has to discuss in the MDT. So remember, all these cases discuss in the MDT. This esophagoscopy, this cancer patient, these things. So whenever they ask you about cancer, discuss in MDT. Dr. Aka, Dr. Yes, anyone else have any question, please? Yes, Dr. Rahil, angry patient, do we summarize in end? Yes, in angry patient, we have to summarize it at the end. So we will summarize it. And Dr. Rahil, don't worry, this one is the recorded session. I will put it on YouTube.
बिल्कुल ना भूलें।
Who is
बेयाली
this?
जवान के गोइल बजान रहले उ हमारा देश के शान सुनमा घर चोद पाकिस्तान माई के गोदी भइल सुनसान रोवे सारा हिंदुस्तान जाए न दे
Who is this? Sorry, guys.
सॉरी सर।
दे हम तोहर छाती फाड़ बही अब की खून के धार कवनो ओकर काम न आई बेटा होई हम हिंदुस्तान के
I'm sorry, guys. Sorry, guys. There was someone. I don't know what is this.
टंगड़ी चिरके हमसे जदी करबे पंगा मारे में बेटा करके नंगा खून के गंगा धार बहा देम तोहर साले दे समझा देम बहुत
different. We can rejoin then with a different code.
बेटा होई हम हिंदुस्तान के
What the hell is this?
I don't know. There is some hacker.
बना के देख हाथ से हाथ मिला के देख हमें तिरंगा हमर शान सुनमा घर चोद पाकिस्तान विकी विकास कन्हैया प्रजापति कहे में बढ़ गइल तोहर अति अब की बार होई
Sorry, guys, I'm going to end the call. We will discuss it.
देव प्रजापति पवनो बाप तोर काम न आई बेटा होई हम हिंदुस्तान के
I love my brown. I love my burgundy. मेरा भरोसा
सूर्या मंडल के धमाकेदार गाने और वीडियो सबसे पहले आपके पास पहुंचे तो लाल बटन को दबाकर चैनल को सब्सक्राइब जरूर करें और साथ में बेल आइकन को दबाना बिल्कुल ना भूलें।
बेयाली जवान के गोइल बजान रहले उ हमारा देश के शान सुनमा घर चोद पाकिस्तान माई के गोदी भइल सुनसान रोवे सारा हिंदुस्तान जाए न देम उनकर बलिदान
मुल्लो तुम्हारी कोई औकात नहीं है हमारे आगे। हिंदू जिंदाबाद है।
कवनो ओकर काम न आई बेटा होई हम हिंदुस्तान के
जय श्री राम।
छोड़ दे सपना कश्मीर के छेड़बे हिंदुस्तानी वीर के रख दे में सरऊ टंगड़ी चिर के हमसे जदी करबे पंगा मारे में बेटा करके नंगा खून के गंगा धार बहा देम तोहर साले दे समझा देम बहुत बढ़ गइल तोर अत्याचार अब ना होई कवनो विचार घर में तोरा घुस के मारब बोटी बोटी तोहके काटब कवनो सर तोरा काम न आई बेटा होई हम हिंदुस्तान के पीठ पीछा करे लवार सुनलो पाकिस्तानी सार तनिको नइखे औकात तोहार सामने से अजमा के देख हाथ से हाथ मिला के देख हवे तिरंगा हमर शान सुनमा घर चोद पाकिस्तान विकी अब की बार होई तोर दुर्गति कहेल दिलीप देव प्रजापति पवनो बाप तोर काम न आई बेटा हई हम हिंदुस्तान के
सारे मुल्ले भाग के सारे मुल्ले। तो ऐसे बोलते हैं हम जय श्री राम।